Hello everyone, this is Ola. In this video, we'll continue our discussion about hormones, functions, and disorders. And here we will focus on the adrenal gland. It is a gland located above the kidneys, so there are two of them, above the right and above the left kidney. And each adrenal gland has two separate glands. The outer part, which is the adrenal cortex, and the deeper part, which is the adrenal medulla. They function in a different way and they are totally separate glands. The adrenal medulla produces epinephrine and norepinephrine hormones. Remember that we have epinephrine and norepinephrine neurotransmitters, but those are hormones because they are released into the circulation. And they are having the same effect like the epi and norepi neurotransmitters, but they continue for a longer time. The adrenal medulla is stimulated by the sympathetic nervous system and respond by releasing the epi and norepi hormones. The outer or superficial part is the adrenal cortex, and this produces steroid hormones. So here there is a question. The adrenal gland contains both neural and endocrine tissue. Of course, this is true because the adrenal medulla is stimulated by the sympathetic nervous system, but the adrenal cortex is stimulated by the pituitary hormone, adrenocorticotropic hormone. Let's focus on the adrenal medulla hormones. So in case of stress, the sympathetic nerve fibers from the spinal cord stimulate the adrenal medulla to release epi and norepi hormones into the circulation. Again, those hormones are similar to the neurotransmitters um, released due to sympathetic innervations, epi and norepi neurotransmitters, but their action lasts 10 times longer than the neurotransmitters. They do the same effect. So they increase the cardiac output, respiratory rate, mental alertness, they dilate the coronary blood vessels, and they elevate the metabolic rates. So they do exactly the same action and stimulate the same receptors like the epi and norepi neurotransmitters. So in case of acute stress, so this is acute stress, not chronic stress, the hypothalamus will be affected by that. Then the hypothalamus stimulates the presynaptic sympathetic cell bodies in the lateral horn of the spinal cord. And here the neurotransmitter to stimulate them is acetylcholine. And the presynaptic sympathetic cell bodies in the lateral horn of the spinal cord will send a signal to the adrenal medulla. So here the adrenal medulla is considered to be a postsynaptic sympathetic neuron. As a result of that, the epinephrine and norepi hormones are released into the circulation. Now let's come to the adrenal cortex. The adrenal cortex is divided into three zones. The superficial one is zona glomerulosa, which is right deeper to the capsule, and this produces mineralocorticoids. The most important is aldosterone. Then the zona fasciculata, deeper to the zona glomerulosa, produces glucocorticoids. The most important is cortisol. Then the deeper one, zona reticularis, produces insignificant amounts of sex hormones. Now, let's go to aldosterone, which is a mineralocorticoid. The production of aldosterone is stimulated by three ways. The first way is chronic stress, like somebody who is living miserable life, like he or she have like a problem in family or prolonged work problems. So this is a chronic stress. And then in response to that, the hypothalamus releases CRH or cortisol releasing hormone. This cortisol releasing hormone stimulates the anterior pituitary to release adrenocorticotropic hormone, ACTH, and ACTH from the anterior pituitary stimulates the adrenal cortex to release aldosterone. What is the action of aldosterone? The aldosterone increases absorption of sodium and water. So sodium and water are retained into the circulation, and potassium is excreted in urine. So it increases blood sodium and decreases blood potassium. As a result of salt and water retention, the blood volume and blood pressure increases. So the chronic stress can lead to hypertension due to that mechanism. The second way to release aldosterone is decreased blood pressure, hypotension. So in case of hypotension, the kidney is stimulated to produce renin. Renin will undergo some enzymatic interactions, and the end result is the production of angiotensin II. The angiotensin II stimulates the adrenal cortex to release aldosterone, and aldosterone again increases the blood pressure back to normal by retention of sodium and water. So increasing the blood volume will fix the blood pressure. So this is a negative feedback mechanism. The third way to stimulate the production of aldosterone is decreased sodium blood level, which is hyponatremia, or increased potassium blood level, which is hyperkalemia. In this case, the adrenal cortex is directly stimulated and aldosterone is produced. And as a result, the excess the excess potassium is going to be excreted in urine, and sodium is going to be retained into the circulation so that the sodium level in the blood goes up to the normal direction and the potassium level goes down to the normal direction. It is also a negative feedback mechanism. Now with the most important glucocorticoid, cortisol. The stress increases the production of CRH from the hypothalamus, cortisol releasing hormone that stimulates adrenocorticotropic hormone from the pituitary gland. So this stimulates the adrenal cortex, and the adrenal cortex responds by releasing cortisol. This is called general adaptation syndrome. Like suppose after surgery, this is a stress. Cortisol here increases, and as a result of that, cortisol increases the nutrient levels in the blood, like glucose, fatty acids, amino acids, and this is required after surgery, for example, and to resist the stress and help repair the injured or damaged tissue. Also, cortisol inhibits the immune system, so it does not over-respond and inflammation does not happen. This is normal, like after surgery, for example. But also, chronic stress leads to increase the level of cortisol, which is a problem here because that continuous increase the level of cortisol increases the blood glucose level, and this leads to diabetes. Also, this leads to water retention, and hypertension could happen as a result. So here the stimulus can be negative feedback by low cortisol in the blood, or time of the day, or chronic stress. And here the hypothalamus releases CRH. CRH stimulates the anterior pituitary gland to produce adrenocorticotropic hormone, ACTH. ACTH stimulates the adrenal cortex to produce cortisol. Leads to cortisol stimulates the liver to change the glucose that is stored in the form of glycogen back into glucose, which is released into the circulation. This process is called glycogenolysis. You know that the liver takes glucose from the blood and store it in the form of glycogen. But under the effect of cortisol, the glycogen in the liver is changed back into glucose that is released into the blood to increase the blood glucose level. Also, cortisol stimulates the lipolysis process from the fat cells. So the fatty acids are going to be released from the fat cells. Actually, cortisol, it changes the fat redistribution in the body. So prolonged exposure will lead to reduce the fat in the upper and lower limbs, but increased fat in the face and abdomen. So abdominal obesity results from that. Also, the cortisol stimulates the protein catabolism. So people who are under the cortisol action for a long time, they lose their muscle mass. Increased levels of cortisol, they do the same action like aldosterone, which is sodium and water retention, and this can lead to hypertension. High level of cortisol for a long time leads to Cushing syndrome. The reasons for that might be due to a tumor affecting the adrenal cortex, which releases high level of cortisol, which is a primary problem. The reason might be at the level of the pituitary gland that has a tumor producing excess adrenocorticotropic hormone, or it might be at the hypothalamus level that produces excess CRH, cortisol releasing hormone. Also, patients who are taking cortisol for a long time might develop the same symptoms of Cushing syndrome. Like, for example, patients with rheumatoid arthritis, they take cortisol for a long time, and they can develop some of these symptoms of Cushing syndrome. Like if you look at the muscles of somebody who is treated by cortisol for a long time, you will see that there is muscle wasting of the upper and lower limb. So here are the symptoms and signs of Cushing syndrome. So if you look here at the face, we call that moon face, excess fat here in the face. Also, there is enlarged supraclavicular fat that we call buffalo hump. Here you can see that there is abdominal obesity. If you look at the upper and lower limb, there is muscle wasting. And if you look at the bones, osteoporosis also happens. Let's go to the other extreme, which is Addison's disease. And here there is a failure of the adrenal cortex. So the adrenal cortex does not produce enough cortisol and does not produce enough aldosterone. The symptoms here will be opposite. So there will be weight loss, general fatigue, because cortisol is needed to reduce some sugar into the circulation, and also hypotension, because what you will see about the blood, you will see that sodium is very low because aldosterone decreases and aldosterone retains sodium into the circulation. How about potassium? Potassium is at high level because, again, aldosterone is decreased, and aldosterone is the hormone that takes potassium out into urine, but it's not there. So hyperkalemia results and hyponatremia results. This leads to hypotension and weakness. Darkening of the skin also happens. The most well-known person with Addison's disease was President Kennedy. Here he is before treated with cortisol, and here he becomes after receiving the treatment of cortisol. So of course there is a difference, so treatment works. All right, let's do some review questions. The cortex of the suprarenal or adrenal gland produces cortisol, aldosterone, and a little bit of sex hormones. How about the adrenal medulla? It produces epinephrine and norepinephrine hormones, not neurotransmitters. Long-term or chronic stress results in an increase the level of cortisol. How about if I say acute stress? The resulting thing will be increase the level of epi and norepi. Cushing's syndrome results from an increased level of cortisol. The adrenal cortex failure is referred to as Addison's disease.